TikTok is jam-packed with unusual health advice, including plenty that appears to be questionable. There's a new one to keep an eye out for: people bleaching their own teeth at home with hydrogen peroxide. Before we begin, please like and subscribe to my channel and press the bell icon to get new video updates. Several people have gone viral on TikTok, including 18-year-old Claudia from Essex, whose video of the process has nearly 3 million views. The teenager purchased a 4-pound bottle of hydrogen peroxide from eBay and applied the liquid directly to her teeth with a cotton bud for up to 1 minute. The bottle contained 3% hydrogen peroxide, which is 30 times more than the amount permitted in over-the-counter and regulated online teeth whitening products. Claudia, on the other hand, appeared unconcerned about the risks, saying in the video's voiceover, "If you're a dentist, don't tell me this is wrong. Save me the grief. The damage has already been done." She also said she was delighted with the results of the DIY procedure. She added, "After 4 days I had to stop using it because it worked so well, so stop wasting your money with whitening strips." While many TikTok videos and hacks can be beneficial, some are more dangerous and not recommended by medical professionals to participate in. Is it safe to bleach teeth at home using 3% hydrogen peroxide? Using 3% hydrogen peroxide, or bleach as it is more commonly known, is likely to result in painful tooth sensitivity at best, says Dr. Kunal Patel of Love Teeth Dental Practice in Surrey. A high concentration, in the worst-case scenario, could cause severe burns on the inside of the mouth, lips, and gums. It may even necessitate gum grafts and tooth loss, which can be difficult to treat. While the results may appear to be immediate, Dr. Kunal warns that using bleach on your teeth may cause pain later on and cost a lot of money to correct. Furthermore, according to the British Dental Association, using the wrong products at home can result in permanent damage. The British Dental Association is concerned about the DIY trend of whitening teeth, with higher levels of hydrogen peroxide than permitted in over-the-counter products. Using higher concentrations unsupervised, as some videos advocate, increases the risk of tooth and gum damage, including mouth burns, tooth and gum sensitivity, and irritated or inflamed gums. Unfortunately, using bleach in the mouth will result in painful soft tissue ulceration, as well as predisposing the teeth to nerve damage and root canal treatment. When bleach is applied to living tissue, the proteins within the cell change their three-dimensional structure. When these vital proteins lose their shape, the cell cannot survive. Because the tooth root is porous, bleach can penetrate deep into the nerve canal and cause the nerve and blood vessels to disintegrate, exposing the tooth to bacterial infection and causing bone abscesses. It is far preferable to have teeth that can be whitened normally, rather than spend the high cost of removing damaged teeth as a result of following unscientific advice on social media sites. Remember that the money you'll save isn't worth the misery and danger you'll face. Thanks for watching. Don't forget to like and subscribe.